Okay, my name is Paula, and my presentation is on advanced practice nursing in population health. So, I'll give an overview of what an APN is, the populations that they serve, their historical development, their current status in the United States and Alaska, and what their role is in prevention. Just an introduction. An advanced practice nurse, or APN, is a registered nurse who completed advanced education. That typically means they have a master's or doctoral level education. APNs are trained to provide a higher level of care. That's including diagnosing illnesses, prescribing medications, and managing patient treatment plans. APNs play an important role in population health. They focus on improving health outcomes for entire groups of people. Rather than only treating illness, APNs also focus on prevention, education, and managing of chronic diseases. There are several types of APNs: nurse practitioners, clinical nurse specialists, certified nurse midwives, and nurse anesthetists. Overall, APNs help increase awareness and access to care and improve health outcomes in many communities. Advanced practice nurses serve a wide variety of populations, but they are especially important in vulnerable and underserved groups. These include people living in rural areas with low income, individuals like older adults and women and children. Many of these populations face barriers like limited access to healthcare providers or a lack of insurance, and higher rates of chronic diseases. Because of these challenges, these groups are considered vulnerable. APNs help to reduce these disparities by providing access to care, offering health education, and focusing on early intervention to prevent the development of more serious health problems. So, for a brief historical overview, the role of advanced practice nursing has evolved significantly over time. In the early 1900s, nurses mainly provided just basic bedside nursing care under the supervision of physicians. However, in 1965, the first nurse practitioner program was developed, and to help address those physician shortages, especially in primary care settings. From the 1970s through the 1990s, advanced practice roles continued to expand with more specialization and greater responsibilities. Today, APNs are recognized as essential healthcare providers who play a major role in improving access to care, reducing costs, and supporting population health. In the United States, advanced practice nurses are increasingly important due to a shortage of primary healthcare providers. Many states allow APNs to practice independently, which is known as full practice authority. In Alaska, this is especially important. Alaska grants full practice authority to nurse practitioners, which allows them to diagnose and treat patients without physician supervision. Because Alaska has many rural and remote areas, there are fewer physicians that are available. As a result, APNs play a critical role in providing care to these communities. Telehealth is also commonly used in Alaska to reach patients who live far from healthcare facilities. Overall, Alaska relies more heavily on APNs as compared to many other states due to its geographic challenges and limited access to care. Prevention programs. Advanced practice nurses are heavily involved in prevention programs at both the national and state levels. In the United States, APNs participate in programs focused on preventing chronic diseases like diabetes and heart disease, and they also support vaccination efforts and provide community health education. In Alaska, prevention programs often focus on rural outreach, telehealth services, and improving the health outcomes for Alaska Native populations. APNs contribute by providing screenings, educating patients, and promoting healthy behaviors. These efforts help prevent disease and improve overall community health. So, in reflection, advanced practice nurses play a key role in all three levels of prevention. Primary prevention involves stopping diseases before they start. APNs do this through educating patients, vaccinations, and promoting healthy lifestyles. Secondary prevention focuses on early detection. APNs perform screenings like blood pressure checks, cancer screenings, and diabetes testing to catch diseases early. Tertiary prevention involves managing existing conditions to prevent further complications. APNs help patients manage their chronic illnesses like diabetes or heart disease to improve their quality of life. In my opinion, APNs are especially valuable because they combine clinical care with education and prevention, which allows them to make a strong impact on population health by improving the outcomes and reducing healthcare costs. And finally, here are my references used for this presentation.